This weekend brought us, of course, the start of May, which means it is now Mental Health Awareness Month. And like everything, it, of course, takes on new meaning with the pandemic and economic crisis that we've all been living through.
And ECMC is the largest provider of mental health services in Western New York. The hospital expanded virtual visits last spring to make sure patients could still talk with their providers. And tonight we want to focus in a bit on mental health. And joining us live is Dr. Michael Cummings, Associate Medical Director at ECMC and Vice Chair of the Department of Psychiatry at UB's School of Medicine. We so appreciate your time tonight. Thanks for coming on.
Well, thank you for having me.
And Dr. Cummings, we know that this extends far beyond what we're dealing with in the pandemic right now. I mean, there were mental health concerns long before the pandemic, and they'll be here long after it's gone. But let's start with that. And what should we know about the pandemic's impact and looking forward? I think how people are going to be processing life as they return to work, as they start to go out more, as they try to achieve a bit more normalcy.
Well, yes. I mean, it's a very important thing. As you mentioned, I mean, mental health has been here well before COVID, and it'll be here well after. Major depression is the single most debilitating disease in the world, more than cancer, more than heart disease. But with the challenges of COVID, it's really been magnified. If you look at approximately a year before the pandemic, about 10%, 11% of adults identified themselves as having depression and or anxiety. That's well over 40% now. So it's been a big change. And in a lot of ways, the light appears to be at the end of the tunnel with things opening back up and with vaccinations. However, that's also causing a lot of anxiety for people of am I going to be able to move back? Will it be safe? Are vaccines safe? And then what will the new norm be for our daily, activities of living, our workplace, all these other uncertainties, which is very anxiety provoking.
And when we asked you for what we should focus on for Mental Health Awareness Month, you mentioned two issues that you said often get overlooked: trauma and PTSD. So why is that the case? And what do we need to understand about these issues that maybe we don't, or maybe we misunderstand?
Well, I mean, trauma is probably one of the most important things for us to be thinking about in the mental health world. In our workplace, there's a lot of conversations about creating trauma-informed workplaces, and that's more important now than ever. And not just trauma-informed workplaces within behavioral health systems, but systems in general. If you look prior to COVID, the population risk of PTSD, post-traumatic stress disorder, is about 4%. If you look at healthcare workers, it's about 18% right now. And it's not just the people directly exposed to COVID, struggles with life, and all these other issues, but it's also the care providers. There's something we call vicarious trauma, which is what you experience when taking care of people who have had trauma. And while COVID is extremely important, something we're obviously focusing on, let's not forget that our veterans have a suicide rate 4 times higher than the general population. That the gay and bisexual community has a significantly higher suicide rate. The transgender community has a significant high suicide rate. And individuals with autism, suicide is the second leading cause of their life. So people who are at higher risk of trauma and post-traumatic stress disorder, we have to focus on them more and more, in addition to the individuals with COVID.
Dr. Cummings, we have less than a minute left, so I'll ask you quickly, as someone close to this, how are we trending? I mean, we've talked for so long about the stigma attached with mental health care. Do you think we're getting more accepting of understanding mental illness, or are we headed in the wrong direction?
Well, I think we're heading in the right direction, but I think whether we're talking about mental health awareness, autism awareness, anything that's along those lines, I think we're past the awareness fact. I think we are now at the call to action. Yes, it's important to not to have stigma. Yes, it's important to be aware of what's going on, but it's really important to take aggressive steps to work with mental illness, with opiate addiction, with trauma, and all the other things that we talked about today. And so we're in the right direction, but we have a lot of work to go from here moving forward.
And again, May is Mental Health Awareness Month. We've been talking with Dr. Michael Cummings, Associate Medical Director at ECMC, and among other positions as well. And again, we appreciate your time tonight.
Great. Thank you for having me.
Yeah, thank you so much. And thank you, everybody, for watching. Remember to text us your questions or comments to 849-2200.